This is a Hope 1032 podcast.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&T Saatchi advertising creative who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful human being.
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday. Gorgeous. Well, as we 40 plus fabulous women know, as we get older, you've got to be careful where you laugh and how hard, don't you think?
Yes.
Because there might just be a bit of the dreaded LBL.
Yes.
Which, lately I've been inundated with Facebook ads for LBL products.
Okay, and most women our age know what LBL stands for.
But in case they don't, light bladder leakage, it sounds so glamorous. And thinking right back to when I was pregnant, I think the midwife said, you really should do these pelvic floor exercises because, you really should. And I was like, yeah, whatever. I've got so much to do. Ain't nobody got time for that. What could possibly go wrong? But now I'm slightly regretting that decision, not to follow through on that.
Well, exactly. I think this is a big, not spoken about enough kind of topic.
Right.
And I was going to say, yes, you're talking about laughing, but there's the other thing where people talk about sneezing or maybe not wanting to kind of jump on a trampoline anymore.
Really?
Yeah, exactly. Stress incontinence as well. So there's quite a lot going on in this space.
I might try doing all three at once and see what happens.
Okie dokie.
We have a fabulous guest today. Her name is Lyz Evans, fabulous surname. And she's a physio and the founder of Women in Focus Physio.
Excellent.
Which suggests that she probably focuses on women, which is perfect for a pelvic floor.
It is
episode.
Indeed. It is.
So gorgeous, Lyz Evans. Welcome to She Wasn't Born Yesterday.
Thank you so much for having me. I'm delighted to be here.
Great.
Gorgeous. On your website, you say there's more to pelvic healthcare than simply doing Kegels. Now,
Yes.
I wasn't sure what that was, but what do you mean by that?
So when we talk about Kegels, what that really means is doing pelvic floor exercises.
Oh.
It's an American term that means Kegels, which basically means squeezing the muscles in your vagina on and off. And so that's what Kegels are. And so when you were told that when you were, having children, you should do your pelvic floor exercises, they were referring to Kegels. But when we talk about the area of pelvic health, and it's just such an important topic for women, there is so much more to it than pelvic floor exercises. Essentially, pelvic health spans, I'm really passionate about this area. We talk about the pelvic area. And the pelvis is really, it's the sacred part of the body that has a lot of women's emotions stored there. It's a really vulnerable area and it's housed by three bones, the pelvis. So we've got the ilium on one side, the ilium on the other side, and the sacrum at the back. And the sacrum in kind of old Roman times was actually derived from the word sacred, and it's a holy bone in many cultures. And it's the sacred space because it houses the vagina, the uterus, the cervix, the bladder, the bowel. And so when we talk about pelvic health, we're really talking about all of those organs, all of the ligaments, the viscera around it. We're talking about the pelvic floor muscle layers, of which there's 3 different layers. And so when we talk about that statement, there's more to pelvic health than just Kegels, it's because of that reason. There is so much more to it.
Okay. And so they're all connected to the pelvic health?
They are. They're all connected. And the pelvic floor, so if somebody sees me, absolutely, I might give them some Kegels or pelvic floor exercises to do. But equally, there's a lot of people that come in to see me that I actually get them to stop doing their pelvic floor exercises because it's actually making their condition worse. So when we talk about pelvic health, we've got issues with the bladder. And we can have issues with the bladder that stem from, let's say, an overactivity of the pelvic floor, or what Amelia was saying before when we talk about something called vaginismus, which is actually an overcontraction or of a spasm of the muscles in the vagina or the pelvic floor. We actually need those pelvic floor muscles to actually relax and not contract. And so there's so much more to what we do and the importance of pelvic health than just doing Kegels. That's what I mean by that statement.
Well, look, tell us why you set up Women in Focus.
Sure. So as you said, I am a pelvic health physio. So I'm what you call an APA titled pelvic health physio, which means that I've really gone down that pathway, really specialised in the area of women's and pelvic and men's health. But in my subspecialty, I'm really focusing on the women's area. So I set up Women in Focus Physio in 2012, really from a place of frustration, to be honest. I was working at the time in 2 different roles. I was working in public health and in a private clinic that was more your standard musculoskeletal sports clinic.
Yeah.
Now, I was frustrated in the public health system for the sick approach, which is we only really treat people when they're really sick and unwell, as opposed to I knew from all the research and the masters and everything that I was doing at the time as to how much of a difference we could make to people if we got to them in a preventative way or early intervention. And then I was frustrated when I was working in the private clinic that I was having to treat men. And I knew so much about women and I was sick of having to specialise and treat men as well. And I just thought women's bodies have to go through so much in their lifetime. They are truly unique. And women's bodies aren't just little men. They are very, very different. And I thought, why don't we have more clinics that really just specialise in on women? And so that was in 2012, which was quite unique at the time. There's more and more women's health clinics around now. But I remember saying to my physio colleagues at the time that I'm going to start a clinic that only treats women, that does no real sports injuries, and does no workers' compensation. And they looked at me like I was crazy. They're like, well, that's absolutely our bread and butter. How many patients are you going to have?
A lot.
All of the rest.
Yes, exactly. So that's kind of, I guess, really what made me kind of go down that path.
Yeah, that's fantastic.
Wow.
Yeah.
You were brave.
I know. All crazy.
We're glad you were brave. At around about that time, I had started doing what I do, which is working in sexual health. So actually I saw, as you would 100% know, I was seeing absolutely eons of people who had vaginismus, and they would think I'm wrong in some way, I'm abnormal, that I must be crazy. And largely doctors, and I'm a doctor myself, so I'm allowed to sleep to them, lots of doctors would say, oh, you need to work on your kind of fear of penetration and blah, blah, blah. And I think, no, this is a very frequent thing. I think it's your body. I think it's your body, ladies. Let's work on trainers and so on. Anyway, so I was going to say I'm delighted that you exist. You're exactly, certainly in my practice, what I've kind of been looking for. Of course, I've worked with people like yourself. But yay for you.
You're just what we need. But so don't men have a pelvic floor too?
Of course they do. They have pelvic floors, but their pelvic floor goes through a lot less than what a woman's does. We're here on a female podcast. I'm really trying to kind of talk to the women.
Absolutely.
I feel like, that we need all the help we can get.
Gentle sledging of men is allowed. Gentle sledging.
Yes. Widely encouraged.
Yes.
So how do we know if we've got an issue apart from bladder LBL?
And I love this little LBL term. I think it was actually coined by some of the continence pad companies.
Absolutely.
Exactly.
Advertising people.
Janet's in advertising, so she understands.
There you go.
Yeah.
I still remember the day somebody first came into my clinic and said, I've just got a little bit of LBL. And I'm like, sorry, what's this condition? And I'm
like a BLT?
Yeah, exactly. Yeah. Just a little bit less tasty. Yeah. But anyway, our body is amazing at giving us little signs. So when we talk about, a lot of people, when they think about pelvic floors, a lot of people think weak pelvic floors, or they often say, I've got a weak bladder. That would be the most common things that I hear women kind of say. And there's lots of other little pre-warning signs that our body is giving us, or our pelvic health area is giving us, that we might need to look out for, that something's not right. And so we talk about things in terms of, do we have good pelvic health function, or do we have pelvic floor dysfunction? And so when we're talking about dysfunction, the signs that we might have is some of those ones you were just talking about, such as urge urinary incontinence. So that's incontinence when you might feel like you need to do a wee and not make it to the toilet on time, or something that a lot of people might be familiar is the old key in the door trigger. You've been out and about, you pop the key in the door, and as you're walking in the door, oh my God, why can't you make that last 10 seconds to the toilet? That's kind of what we call certain triggers. Key in the door is one of those typical ones. So you've got urge incontinence, stress incontinence, which is what you were talking about before, the jumping on the trampoline, the coughing, laughing, sneezing type leaking.
Yeah.
So you've got those types of incontinences. So those are obviously signs that are pretty obvious signs that something's not right in that bladder pelvic floor mechanism. But other signs that we might have that things aren't quite working well, or little signs that might start to come up might be to do with the way that you're actually passing urine. So getting to the toilet and the urine might start to come out a lot slower than it used to, or it might start to deviate sidewards or backwards more, or you might have used to be able to stop the urine flow on the toilet and now all of a sudden you can't even slow it down. So they're little early warning signs that your body's giving you that things might not be responding and functioning as well as they used to. You might have signs that there's a bit of a heaviness in the vagina, so like there's a tampon sitting there or something's falling out, and that can be a bit of a sign that we've got possibly some early signs of prolapse starting. We might have issues controlling our wind. So our pelvic floor controls our back passage as well as our urine. So wind control issues or holding stool in the rectum can be signs that the pelvic floor is not functioning as well. And then we get into our other compartment, more the vagina, where we can start to see that the pelvic floor is not functioning as well, which is more in the sexual realm. So lack of sensation, lack of arousal, lack of tone and feeling during intercourse, or on the other side, more painful intercourse. So there'd be little early warning signs, and some of those might just be that tampons are starting to become painful, or for some women, tampons are starting to fall out.
Yeah.
So lots of little signs that kind of will help us know which realm of the dysfunction the pelvic floor is on, because we can have, like any muscle in the body, we can have a muscle that is too tight, or we can have a muscle that is too lax, we can have a muscle that is too strong, we can have a muscle that is too weak. And so, part of what we're trying to piece together in this space is to work out how your pelvic floor is functioning and how it might be feeling in.
Just to intrude for a second, I was going to say the other thing, of course, is we can have a muscle that's not very coordinated. So you can also have one that's a bit strong, a bit weak, like it can't make up its mind.
Absolutely. Yeah. We get a lot of those. I often say to patients, if the pelvic floor was on your arm, and you could see that wasting away, you would actually kind of jump into and go, oh, I'm going to start doing some bicep curls, let's say. Or if you can see that it's getting contracted and really painful and all caught up and you actually can't release your elbow, you go, oh, I should go and get some treatment to get that sorted. But because the pelvic floor is up inside where we can't see it, it's a bit out of sight, out of mind until there's a real problem. And then that's when people are like, oh, my God, help.
Yeah, that's right. And they come and see you.
Absolutely. Hopefully.
But actually, they may not.
Not always.
I reckon that women are only just becoming aware that kind of pelvic floor physios even exist.
Yes, that's a good point, actually. Yeah. Because I certainly didn't know, that you'd see a specific physio for that problem.
Yeah.
I just thought, you'd ramp up the exercises or something like that. You know what I mean?
Yeah.
But it's not necessarily women who've had kids. Are they more vulnerable to public health? In fact, pelvic health.
Pelvic health. I mean, it would be great if public health helped children, that women that had children more. That would be wonderful. But absolutely. So we've got kind of, I guess, risk factors as to why people might have pelvic floor issues, pelvic health issues. So certainly women that have had children, multiple children and multiple vaginal births are going to be more likely to have issues with their pelvic floor. Okay. In terms of leaking, prolapse, those types of things. People that have a history of sexual trauma are more likely to have issues with their pelvic floor as well. Women that have history of constipation or recurrent respiratory conditions such as recurrent
like coughing,
bronchitis.
Cough. Yeah.
Oh, really?
Exactly.
Okay.
They're more likely. And then we get to kind of that perimenopausal, menopausal phase of our life, which I'm sure many of your listeners are kind of, in this phase now. And it's an area where we really do start to see rates of pelvic floor dysfunction and LBL and all these types of things start to increase. And, we do know that from the age of 30 that our muscle mass decreases, everyone's a little bit different, but somewhere between 3 to 10% per decade. And we often think of that muscle mass decreasing in our face or our arms or our bums, start to become a bit kind of more pancake-like or, whatever. But the same is happening for your pelvic floor and the muscles around your urethra.
Yeah.
That it's a bit of a slow decline. And so, it's one of those things that I just wish that more people knew, as you said, about their pelvic floor prior to even having children, because the pelvic floor muscle is a bit like a bank where you can put the deposits in and really build up a good pelvic floor and build up a good muscle bank so that when you hit that perimenopausal, menopausal time and those receptors so our muscles have estrogen, progesterone and testosterone receptors in them, so all those hormones, and specifically in the pelvic floor as well, like high levels. And so when our ovaries stop pumping out all of those hormones, the pelvic floor muscles, they start to actually not get as much input, and those pelvic floor muscles start to waste away a little bit as well. So yeah, it's something that I think that many people don't think about until they hit that time.
What are the consequences if you ignore those little signals and you don't go see someone like you?
I think that the consequences is that that's when you might start to get some symptoms that start to impact your life. And I think we can all get away with a bit of LBL, a bit of LBL. Everyone like, I'll pop a little liner on, I'll be fine.
Yeah.
And that doesn't affect your life too much. We can carry on and that's fine. But when that progresses and that muscle mass continues to deteriorate, if we're not engaging with our pelvic floor, then things start to become a little bit more impactful in the life. So all of a sudden that little bit of key in the door that I was talking about, or that LBL, or that little bit of heaviness progresses. And we see women or men, but let's keep on women, they start to, not go out as much because they're worried because they don't know where the bathrooms are. Or they start to map the bathrooms. Everywhere they go, they know where all the toilets are.
Right.
They start drinking less fluid, less water, because they're worried that they're going to leak. And when they stop drinking less fluid, our body's made up of 70% water. We need good water intake to have good bowel motions, good overall health. And so they start to dehydrate themselves in the day, and then often when they get home at nighttime, they guzzle water. And then that guzzling water at nighttime, I see this commonly feeds into women waking up multiple times overnight. In perimenopause, menopause, we've got increased night waking anyway. And all of a sudden they're waking up way more times at night than they absolutely need to because they're guzzling the water at nighttime. So that's just one example of how it progresses from an incontinence point of view. If it progresses on a prolapse point of view, this is where women, some of the listeners might kind of start to feel that a bit of heaviness or something rubbing around their vulval area that starts to bother them. And then that starts to mean that, hey, the tennis that they're playing, they stop playing tennis because they don't like that feeling of heaviness, or they start to notice that they're leaking more, and it starts to really feed into their life, and not just that side of the life, but also, your Amelia, your sex therapist, which I love. But I'd say the biggest thing that I see impactful to particularly perimenopausal, menopausal women is in the sexual health side of it. And I think that because of the taboo of talking about sexuality and sex in public, I think that the role that pelvic floor health plays in sexual function is really downplayed.
Yes.
It comes up in the postnatal period where women kind of don't feel like having intercourse, returning to intercourse. The hormones have kind of dropped through the floor. And it's talked about, and women are encouraged to return to intercourse. But I see in many of my women, particularly kind of postmenopausal, where it's almost just accepted that sexuality starts to decrease, arousal decreases, libido decreases. And I think what's really interesting is that there was a kind of a study that was published in the Journal of Sexual Health, and I'm sure you're all over this research, but essentially kind of, they showed they had kind of two groups of women, and they only recruited women between the age of 45 and 65 that were sexually active, that were postmenopausal, and had no pelvic floor dysfunction. And they compared these two groups and they analysed them on ultrasound and did pelvic floor exams, and the ones that had good pelvic floors versus not well-functioning pelvic floors on all the sexual functional index, so the FSFI questionnaire, which is essentially a sexual health questionnaire. The ones that had functioning really good functioning pelvic floors showed much better levels of arousal, libido, and better orgasms. And I'm like, if that's not enough to motivate everyone to do the pelvic floor exercises in the postmenopausal period, I don't know what is.
Better sexy time.
That's right. Way better sexy time and higher arousal.
When, is it a good time to sort of start focusing on our pelvic, not public, but pelvic floor health?
If I could, kind of rewrite the high school curriculum, I would.
Same here. Same here. I agree. Like, poor little girls. Even, kind of 16, post going through puberty, poor girls, because everything's tucked away, like you're talking about with pelvis. It's all tucked away, whereas men wear it on the front, and so they kind of know what's going on a bit better. But poor little girls, like when they look at tampons and tampon ads, are going, what? I do what? That goes where? Like, what does it look like? We don't have good models, I don't think, in school. Like, we have bits of paper that you might occasionally see that if you don't have a good three-dimensional brain, you don't know what's going on.
Why is the liquid blue?
Yes, and look, I get grown women that have had babies come in and often surprised to work out that the urine doesn't come out of the vagina. That there is three, there's the urethra, the vagina, and the anus.
Yes.
So we've got grown women that have lived their whole lives and don't know this very basic anatomy. And so, I think that it should be a part of kind of high school, curriculum, the education.
Yeah.
I think that, that there's high rates of endometriosis and period pain. That's kind of, and I think if girls kind of got a better understanding of their pelvic floor at that young age, it would really help them to talk more openly about pelvic floor at an early age. And then in high school, a lot of girls, they avoid going to the toilet to open their bowels, right? And so this whole pattern of constipation and straining to open their bowel starts. And so that's literally, I often think, is the beginning of pelvic floor dysfunction where people are straining on the toilet. So that would be a key point. Obviously, if women haven't got that, because I think we're going to have to fast forward 10 years before we even get there realistically. So absolutely in the childbearing years, if pregnancy, postnatal, we've got really great research that if you can do your pelvic floor exercises in that time, it really sets you up.
Now you tell me, Liz.
However, I know that our listeners are over the childbearing years or coming out of it. And so I think it's really important to know that it's never too late. And if you look at the research on postmenopausal women or perimenopausal women, and it does not matter when they do it, they still get really great results with pelvic floor training. And so it's a case of use it or lose it. You're never too late to build muscle and add back into that bank. And I think that that's what I often see people kind of go, oh, I'm beyond that. I think I just have to wear a pad for life. And I'm like, no, you don't. And so probably one of the most rewarding parts of my job is, when people come in and then they can get back to that exercise or go on that big family holiday they wanted to go to because they've now got their bladdering.
Or jump on the trampoline with the grandchildren.
Yeah, and turn the key in the door and then jump on the trampoline.
That's right.
But so what sort of process do you go through when a woman presents to you? What do you do with them?
So when a woman comes in, I will always spend an hour with them on the first session, and that's a real honour, I think, to spend that time with somebody for that long, because I think in this day and age, everyone's rush.
Yeah.
And I always just start by letting them tell their story. And every single person's pelvic floor that walks in my door is attached to a body and attached to a history and attached to a story and has a different goal. So I spend a lot of time taking their history and their story and work out what they want to achieve out of the session. Sometimes it's just fix the LBL, but sometimes it's a lot more complicated than that.
Yeah.
So a lot of time gaining that trust. And then if their symptoms indicate it, I would normally then want to do a pelvic floor assessment. So that would start with an external ultrasound where I look at their bladder and I get to show them on the screen, and they love this. I get to show them on the screen their bladder and their pelvic floor muscles underneath it. And when they do a pelvic floor squeeze, we can see if that pelvic floor lifts the bladder up, doesn't do anything, or if it goes down. And it's really wonderful for women to see, because on that first session, they're often like, oh my gosh, I've been doing pelvic floor exercises for the last 10 years, but I'm actually pushing the bladder down. And I'm like, yeah, well, I'm glad you've come in because now we can retrain that. And usually after a few sessions, we've reversed what the pelvic floor was doing. So it would start with a bit of an ultrasound. And then if she consents, and I would always go through the process of why I needed to, I would do a vaginal examination on the woman if she's happy to, because I can gain so much more information from that, and I can really help to teach her how to do pelvic floor exercises properly, or work out not just pelvic floor exercise, but work out actually what the problem is. Because as I said earlier, sometimes I don't do any pelvic floor exercise with somebody, and in the case of a vaginismus or painful intercourse, that type of presentation, I would actually spend the time to teach her to relax her pelvic floor, do some diaphragmatic breathing. I do some internal release work with her to actually help her lengthen and restore the normal movement and then restore the normal range available in her vagina, which often gets too contracted up. So that session, I would do a lot of education and a lot of assessments with her at her own kind of pace. And then after we've done that and I've worked out what I think's going on, I would talk to her about essentially what my hypothesis was and what I think we needed to do. And then we embark on a treatment journey together, which might be pelvic floor exercises. She might be seeing me just for a few sessions, or she might be seeing me for quite some time. And sometimes it is as simple as going home and doing some structured pelvic floor exercises, and we'd normally be doing those for at least kind of 12 weeks to see a response with a little bit of LBL, let's say. Right. So we'd be looking at 3 months to make a bit of a difference with LBL, and we've got really great kind of results and, cure and treatment rates with that. But if somebody had a bit more of a complex kind of issue, I then might need to we've got all sorts of wonderful tools and gadgets that we use. So we use vaginal weights, we use electrical stimulation.
Sounds scary, doesn't it?
It sounds very strange.
I was going to say, explain the vaginal weights. Actually, they've been around for a long time, actually. Yeah, listen to this, Janet. Listen
this is
to
fascinating.
it's a fascinating world that I operate in. So vaginal weights, there's all different types. So there's some that are kind of what we call cones, which are essentially, they look a bit like a tampon, and you can open them a bit like a babushka doll, a mini babushka doll. And you open them and you put weights inside them and various weights. So you start with just the babushka doll, and then over time you add more and more weights inside the babushka doll, mini babushka doll, and you pop that in your vagina, and you might just start by trying to hold it inside for a minute. And then I might have you doing some squeezes or trying to stack and unstack the dishwasher with it in. So that might be what we do with cones.
Okay.
So that would be a form of vaginal weights. And then there's some ones that kind of, I think it depends on how hardcore you go, because there's some people that go really hardcore where there's something that goes inside, and I'm not joking, there's a little hook that hangs on the outside, and there is literally plates of weights that you lift up and down.
Those are the ones that I'm familiar with. So
I thought you were
Really?
Yeah.
Personally familiar? I know that's a personal question.
No, actually not personally. No,
Yep.
because I'm a doctor, so I've seen them. Yeah.
It's like a gym inside you.
Like a little gym.
Like a gym,
right.
yeah.
You got
cute.
some weights hanging out that you're lifting up and down. So, that can be for some women. And so I've certainly used those with women that, let's say, are high-level athletes, and I've got to get their pelvic floor super strong so they can get back out on that netball court, or they can get back out on that squash court, or whatever their sport is.
I guess swimming is not so critical, right?
Swimming's not so critical.
Because you're surrounded by like bladder leakage.
I'd be thinking that any of those tennis players who've had a baby, they would be exactly perfect.
Your target market.
Yeah, target market.
Absolutely. And I think that, athletes are their own unique kind of category, because they need a pelvic floor that is far stronger than the rest of us that are kind of,
the normal people.
The normal people, that's right. So that would be kind of, I might do weights with somebody. There's a lot of women that really struggle with their pelvic floors. So we might do something called electrical stim, which is a probe that we kind of pop in the vagina. It's the same as if someone's recovering from a stroke, and like little TENS pads or something you put on it makes muscles work.
Yes.
Okay.
So we pop those types of things in the vagina, and we kind of help women to get those muscles firing again. So there's lots of gadgets and tools that we use with people to kind of either help them up train or down train their pelvic floor. So yes, that might be what the journey. I know that sounds really full on, but it's a long process to get to the point where I'd be getting someone to do those vaginal weights or whatnot. We normally kind of just take it slowly to start with, to try and really make them, have those smaller steps to start with to make a bit of a difference.
I don't think it sounds full on at all, but agreed.
Great.
Okay, so maybe I do what I do, so it doesn't sound full on.
Yes, that's right.
It sounds fabulous. To me, what you're doing actually sounds fabulous. Yeah.
Yes.
No, it's good.
Sounds
it's good.
crazy to me.
Actually, I remember hearing a rumour, Liz, which I think is just a rumour, but when I was young, I hate saying that now, when I was,
Younger.
30 years younger, people said, French women, when they start to menstruate, I think, go in for their first consultation with a gynecologist, and they're taught how to do Kegel exercises, which to me, it sounds full on. But also I thought, actually, this is great. Is this true? One, I quite like the myth. Everyone thinks that French women are so kind of fabulous.
Glamorous.
Yeah, exactly, glamorous. That it's going to motivate us normal plebs to go and do it when we're young, because we want to be as French and gorgeous as possible. But the idea was very interesting to me too. I'm sure it's not true, but that women there would actually go and kind of learn about their pelvic floor early and kind of consider it throughout their life.
Look, I don't know about that specifically. It does not surprise me at all, because the French culture have a real focus on sexuality and really the divine feminine, which I love. But what I do know is that in pregnancy, in the postnatal period, so in Australia, we get nothing. You might hear about your pelvic floor from a pamphlet and that's it. Or you might get it, if you're on the postnatal ward, you might get a bit of education on the postnatal ward. If women want to learn about their pelvic floor and do their pelvic floor exercises and have some postnatal rehab following their births, they have to pay for it. Or they can go to the public health system and sit on a waiting list if they've got a problem, not just because they're trying to be preventative. However, in France, all women that have a baby get 8 to 10 free physio sessions, pelvic floor physio sessions paid for by the government.
You see, I'm loving that.
That's not fair.
Yeah.
We should get that too.
Or we just go to France and have our babies there and eat croissants and be fabulous.
Yeah, gorgeous. I like that too. Yes.
So, in France, they definitely put more of a focus. And so what I see, I'm in Sydney, what I see in Sydney is I do get a lot of French women that just bring themselves into the clinic and say, hey, I want to start my postnatal rehab now. I'm here for it. Exactly.
Yeah.
So it wouldn't surprise me. I don't know about that, but it wouldn't surprise me.
I know. So mine was probably a fantasy, but that's interesting.
That's
really
great.
interesting. Yeah.
Well, you were right. So what was the connection with endometriosis before? Because that's quite a serious condition. Is that right?
So endometriosis is a condition that is kind of very common where basically cells of the endometrium, which is the inside lining of the uterus, are found outside of the uterus. So they're found in the bowel wall, in the vaginal cavity. So those endometrial cells shouldn't be found anywhere else. However, they start to travel. And so it's a bit of we don't know enough about it. But essentially when endometrial cells are found in other areas, so it's often found in the fascia and the ligaments between the bladder, the bowel, the uterus, or within the muscle of the uterus, that it starts to give a lot of pain because they've got cells in the wrong place. And so people with endometriosis have severely heavy periods, severely painful periods. And when you've got that, what happens is the muscles in the pelvic floor and the abdomen contract a lot and they go into spasm. And so it starts off this cycle for these young girls that are then having overly contracted pelvic floors that are very sore and tight and tender, severely debilitated with their menstruation every month to the point where they are vomiting, missing a whole week of school. They don't know about it. And so they keep on, taking that Progesic, going on, various pills and, OCPs or oral contraceptive pills to try and help. And they're really kind of flapping around, not knowing what they should be doing. But what's happening under the surface, and this is what's wonderful now is there's more awareness of it, is these pelvic floor muscles are getting tighter and tighter. So by the time they go to have intercourse for the first time or have a baby, we've got such overly contracted pelvic floor muscles that they then have a lot of issues. And that pelvic floor dysfunction stems from that really young age. And unless we've got pelvic health that physios that kind of help to, or we've got doctors that are going, hey, go and see a pelvic floor physio at that young age, they don't know. And it really stems onto pelvic floor dysfunction later in life. And so, it's, and it's not just for young women. We've got women that start to feel endometriosis symptoms later in life as well. And so I think that's something that's really important for women to know.
Yeah, wow, I didn't know that actually.
That's really one of the reasons you didn't know it is that it's only really probably in about the last 5 or more years just started to be talked about more, which is why, you wouldn't have heard much.
Yeah, wow. Yeah. So is there any sort of, condition or something that you can't really help or fix?
I don't like treating knees. I don't like treating men.
We're getting that flavour. Actually, I feel like I need to inform our listeners too that Lyz is using her hands a lot, which is great. Like she looks fabulous, and she's doing everything with her hands, which I tend to do too. So actually, I'm sorry you can't see her because she's doing a beautiful uterus in the air and,
a lovely vagina.
And a lovely pelvis and a lovely sacrum and, it's all kind of fabulous, but you can't see it and I'm really sorry. Anyway.
Yeah, I use my hands a lot. I can't help it.
Yes.
I mean, look, in terms of the pelvic health space, which is kind of, obviously the area that I treat, like, for example, we can't fix endometriosis but we can help the symptoms. Yeah. There's some injuries following having a baby, let's say, that I can't fix. So there's certain really deep muscle tears that occur, let's say, called a pelvic floor muscle avulsion, where the pelvic floor muscles, and this is important actually for your listeners to know because if you're somebody who had a baby that was born via kind of a really big baby or a baby that was born by a forceps birth, we now know that we've got a high rate of a muscle tear that happens deep in the pelvic floor. So not on the outside, but much deeper inside. We've only known this in about the last 10 years. And so the women that have had these deep tears then are hitting later in life and are actually not knowing, but they're getting a lot of pelvic floor symptoms such as prolapse starting and they're not sure why. And so if you're somebody that's had a big baby and not been to a pelvic floor physio or had a forceps delivery, I would really encourage you to get to a pelvic floor physio so that you could see if you've got one of those muscle tears because unfortunately we can't fix those yet. They're really working hard on the surgery to see if they can.
Right.
But we can do a lot to build up the muscles around it. Does that make sense? And so there's lots of things we can't, your question was, is there anything I can't fix? And I'm like, well, yeah, there's actually lots, but it's about looking at that whole picture and what can we fix and what can we build up around it to compensate for maybe what injury there is there.
Yeah, wow. Babies really have a lot to answer for, don't they?
They do.
They do.
You know.
But like you said right at the beginning, you said women's bodies just go through so much. And actually, we've had him on this show, actually. We had a very nice male nutritionist, and he actually once said to me, women's bodies are just decimated by having a baby. And which... He wasn't being mean. He's not that kind of guy, but he could just see that hormonally and physically and in so many ways, being pregnant and giving birth, is a big thing. It's a big thing for women to go through. And
it's not natural.
And and there wasn't much to actually support women in that space until just recently when we did get pelvic floor physios.
That's right. Look, I couldn't agree more. And I think that what I'm seeing now, and I think I have a really strong passion for is which is why I started kind of a clinic, but is really that education, preventative and early intervention piece, which is why, when I'm asked to come on podcasts, I'm like, yep, absolutely, I'll do that, because if we can get into more women's...
Spread the word.
Spread the word, that's right. And give women that validation that what your body's been through is a lot. And, whether you've had babies or haven't, just the hormonal changes that women's bodies go through from menstruation, getting your first period menstruation through to kind of all the way to menopause, your body changes a lot through that time, very different to men's bodies. And I think that the more we learn about the female body, the more complicated we know it is. But we do know that the women that do tend to do better through life and through those kind of life stages are the women that do stay active and strong. And, by investing in your pelvic floor or the rest of your body really through those life stages, it makes a huge difference to your kind of functional capacity, your aging, your wellness as you kind of get older. And I think that it's great that all of these discussions are happening more and more.
Fantastic.
Yes.
Actually, question to Lyz. When do you think any woman should first go and see a pelvic floor physio, even just to get the concept in her head?
Look, I often see people for the first time in pregnancy. I would love women to come earlier if possible, because what we're seeing now is I'm kind of seeing so I've been a physio for 20 years. I've seen almost a female's body change a bit in that time. So the women that I'm seeing these days they're a bit more highly strung, and we're busy, we juggle a lot, and the pelvic floor is often a little bit more tightly wound, as is the diaphragm. Women are doing more exercise generally. I'm talking about kind of a history like doing Pilates and weights. And so with that comes these pelvic floor muscles that are a little bit on the kind of the tighter side, if you like. Not always, but, we're starting to see that come through a bit more. And so when we're seeing women in pregnancy, we've got this muscle that has been tightening for so long. And women do 10 Pilates classes, it's like pulse, 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 tighten, tighten, tighten. And then all of a sudden in childbirth, you have to push your baby out past a muscle that actually has never learned how to soften and lengthen. And so what we're now changing a lot, and what I spend a lot of my day doing, is teaching women how to unwind their pelvic floor and not just strengthen it, but relax and open it. And so I see a lot of women in pregnancy and I prepare their pelvic floor for birth. So I actually help them to lengthen it. And I also involved in the creation of an app called the EMP, Empowered Motherhood Program. And that really stemmed from that place of going, I'm in Sydney and I'm reaching X number of people via an online resource. You can reach rural and regional mums, which I'm reaching so many rural and regional mums through the Empowered Motherhood Program. And essentially in that program, I'm teaching women in pregnancy how to do their pelvic floor exercises, but more importantly, how to relax and prepare it for birth so that their body isn't so decimated in birth. Because I think, and we're starting to see a change in how women are birthing.
Right.
Yes.
Yeah. So we're starting to see a change in how women are birthing, because now they're starting to understand how to push properly and how to open and lengthen their pelvic floor. And then post-birth, how to get onto early rehab quickly. And, people, I often, patients that come in, they're in their kind of 50s and 60s, and they're often just like, oh my God, I wish I had this. And so, it is a thing that times are changing. And so, look, I would love to see women in pregnancy, but of course, if I can see them earlier, and I think if there's listeners that are listening and they've got teenage daughters are starting to get first periods and really painful periods, I would encourage you more to get your daughter to a women's health physio to kind of help them early.
How many of you are there around, Liz?
There's a
We
lot
need
of
more
us.
of you.
Quite a few.
There's a lot of us.
Quite a few.
Really?
Yeah,
Yes.
we are multiplying at a rapid rate. So certainly when I kind of went into this field was pretty early on, and it was seen very much like every second person I would see would be like, often mid-vaginal exam would say, and how did you get into this work again? What made you choose this? Whereas now it's, people are bringing themselves in, that they're more and more aware of it. So we've got thousands of us. We're all over the country. We're all over the world. Yeah, we need more of us. And I think that really comes from a place of we'd love the government to provide women with more like a really substantial rebate to see us because it can, in a bigger picture sense, by getting onto things early, we can prevent costs to the government, cost to hospitals for preventing issues and surgeries and things, but we are kind of not there yet. So at the moment, it's up to women to know that we exist and to kind of just type into Google local pelvic health physio and you'll probably be surprised as to that you'll actually find someone in your community or kind of the couple of towns away that are actually kind of doing what I'm doing.
Yeah. I'm just thrilled that you can, you're reaching rural and regional areas, because a friend was saying to me the other day, like she listens to the podcast and she was saying, don't forget us people in the regional, regional
We don't
towns,
forget you ladies.
but it's, it's true. A lot of the services are very metrocentric, and the fact that they can access your services or your expertise.
I agree. I have a really special place for the kind of rural and regional population, because they're often the ones that need more help. They're, they've got often more physical jobs, often have more children, and so they actually need that help. And so they're often the ones that are really, really motivated. And, certainly what I see through the app anyway, which it's an app for pregnant and postnatal women, but then that stems onto later in life. Honestly, the feedback that you get that comes from these women that are just so grateful to have a resource that they trust, and everything is just kind of, it makes it really worthwhile.
Wow. Well, I have learned a tremendous amount today about...
I was going to say, this is a favourite kind of area for me, so I'm delighted to welcome you in, Janet.
into your world.
Yes,
I had no idea you could do so much with your pelvic floor, including go to the gym, lift weights, lengthen. What was the other thing?
You can become a weightlifting champion.
Yes. There could be a whole new sport, in the Olympics, vaginal weightlifting.
Yeah.
That's it.
You'd have a very small camera, to cover it.
It really might not pass
That's right.
the ethics committee.
No.
It's women's business. It's out there. It's in there, but it should be talked about more. And today, I think
Maybe Brisbane Olympics, we might get it there.
Yes, Bris Vegas, always up for something like that.
Oh, that's excellent. I'm sure one of the most fabulous things that we've done when this is made and out there is actually just bring more kind of appreciation for the fact that pelvic floor physios are out there.
Yes.
And you really probably will benefit from going and seeing them. Yeah, it's never too late by the sounds of it. And even if gains are small, they may be very significant. Yeah.
You really only need small gains. And I know I'm biased, but I think the pelvic floor is the third most important muscle in the body, second to the heart and the diaphragm, which keeps us alive because I think that, it keeps us continent of urine, continent of feces. It gives us good sexual function and it supports our back and our core. And all of those things are really important for kind of living life to the fullest.
Lyz Evans, you talk a very good talk, doesn't she? Very informative. Thank you ever so
much, Liz.
Not a problem. Thank you so much for having me, and thank you from all the pelvic health physios for helping to spread the word as to just how important it is.
Gorgi, we hope you enjoyed this episode, but we'd love to get to know you better and share more about our lives, what we get up to, what you get up to, and some insider goss and cheeky sneak peeks.
So why not join our Facebook group? It's called She Wasn't Born Yesterday, for lots of little extras. Your chance to comment, make suggestions, tell us if there's a topic you'd like us to talk about.
Or just to say g'day. Either way, join us next week on She Wasn't Born Yesterday. We look forward to your company.
Hope 103.2. Thanks for listening.